The broadcast is now starting. All attendees are in listen-only mode.
Hello, my name is Danielle Deptak, and I'm the support facilitator at the Self-Management Program in Southeastern Ontario. We would like to welcome you to the sixth of our series of Lunch and Learn webinars for healthcare professionals, which is part of our efforts to build various communities of practice in the region. I just have a few housekeeping pieces to mention before we begin. As you will notice, you are all currently muted. In just a moment, I will unmute everyone. And if someone on the phone is having some issues connecting to the webinar portion, please speak up at that time, and I will take down your information, and we can troubleshoot offline. Then before beginning again, I will mute everyone once more. If you have any issues during the webinar, please get my attention by raising your hand virtually. So on that little webinar window, there's a little icon of a hand. And if you click on it, it'll tell me that you're trying to get my attention. Or alternatively, you could just start typing your question or your issue into the chat box that is also in that webinar window. Okay, so I will just unmute everybody now and let me know if there's any issues. Okay, so does anybody have any problem? Okay.
Danielle?
Okay. Yes, I see the note about the feedback. We've been trying to troubleshoot that issue, unfortunately. And I'm going to have to call GoToWebinar to fix that. I'm going to try my best. I'm even going to try stepping out of the room to see if that'll help at all. But does anybody else have any issues connecting? Okay, so just to note, we will be answering questions at the end. But if you're worried about forgetting them, please feel free to type your question in the chat box as you think of them. And then what I'll do is at the end, I will read them out loud and unmute everybody so that there can be a discussion and further questions. If you would like a printout of the slides with space for notes, it could be downloaded from our website via the direct link that was provided in your reminder email. Lastly, I just wanted everyone to note that we have not scheduled a webinar for the month of December, and we will resume once again in January 23rd. Now I'd like to present our speaker for our sixth webinar, Medication Self-Management, who is Luba Shepherd-Ticky. She should hopefully not have the same feedback that I have, as we noticed earlier. Luba is a graduate of the University of Toronto from the Faculty of Pharmacy in the late 70s. And she then worked in hospital pharmacy in both Toronto and Winnipeg. In 1981, she moved to Thompson, Manitoba, and worked as a pharmacist in both community and hospital practices. Education of the public, physicians, and students, both in pharmacy and nursing, was a great passion and focus throughout her career. And this led her to mentoring many new pharmacists and pharmacy students through the University of Manitoba. 1 year ago, she moved back to Ontario, is currently a primary care pharmacist with Belleville and Quinte West Community Health Center, where education is still an important focus. So now I'm just going to pass things on to Luba. And you'll be able to see her screen in just a moment, and hopefully the feedback will disappear as well. Luba, you can go ahead when you're ready.
Okay. Thank you for spending your lunchtime with me. So my presentation is on medication self-management, which brings us to what is considered to be a medication. Looking at the left-hand side of the slide, medications come in different forms, lots of different formats. And what are considered to be medications? On the right-hand side, we start off with prescription medications. They are medications such as antibiotics, blood pressure medications, and other medications which are obtained with a prescription from a provider. Other medications are things that we call OTCs, which stand for over-the-counter, and such medications can include allergy medications, cough and cold medications, certain anti-inflammatories. Others are vitamins and minerals, natural health products such as herbals, homeopathic medicines, Then there's traditional medicines, which could include medicines specific to certain cultures or countries. Besides prescription medications, which are in a pharmacy, the other medications can be purchased either at pharmacies, other retail stores, natural health food stores, or received from such people as medicine men. So we start off with medication management, which is defined as patient-centered care to optimize safe, effective, and appropriate drug therapy through collaboration with patients and their healthcare team. Managing one's medication has been recognized as an important everyday function and is essential for safe, independent living. And that brings us to medication self-management, which is defined as the extent to which a patient takes medication as prescribed, including not only the correct dose, frequency, and spacing, but also its continued safe use over time. It really recognizes the central role played by the patient in successful management of their medication. So let's bring it into practice. In primary care, medication is usually prescribed by a general practitioner or a nurse practitioner, is provided by your community dispensing pharmacist, and then self-administered by a patient. So, sounds simple, and it should result in a well-controlled system, but this is not often the case. What are the requirements for successful medication self-management? Firstly, the willingness to succeed. Sometimes this is the struggle, that patients want to succeed, but they're really not willing to put in the time and the work themselves to become successful. Another issue is cognitive ability. Questions can arise if people, especially older people, if they're able to manage their medications. A person's capability to do so is dependent on his or her ability to carry out a complex task. Little is known about the relationship of self-management ability and medication management capability. We also think of functional ability. Is the person even able to open a medication vial? Can they understand what a dosette is and how to use it? A patient's well-being. If a person's self-management skills is defined as the ability to maintain control over one's life and well-being deteriorates, then the person may be more likely to make errors in complex tasks such as medication management. A goal of medication self-management is to take medication safely and prevent or decrease the occurrence of adverse effects. Special attention should be paid to patients at high risk. So what are risk factors? Well, the number of medications a patient's taking, which is often equivalent to 5 or greater. Multiple changes to a patient's medication regimen. If something is consistent, often it becomes habit. But once there are changes and the medication regimen is complex, then it adds to adverse effects occurring more readily. A patient is discharged home without supports. If it is known that a person cannot take care of their own medication without help, obviously the end result will be problems without supports in place. A principal diagnosis of cancer, COPD, stroke, heart failure, diabetes, and depression. So that brings us back to the previous slide of well-being. So if this indicates the patient's well-being is decreased, then possibly the performance of the task of taking medication by themselves becomes a problem. Also, once these comorbidities are in place, there's a greater chance of more medications to be taken, which makes the regimen more complex. Prior unplanned hospitalization within the previous 6 months, which can lead back to well-being and number of medications. So I'm going to present a 6-step model for medication self-management. This is the model, and the 6-step model provides a comprehensive examination of the range of tasks that individuals must successfully complete to manage their medication regimen. This 6-step model helps healthcare providers understand the complexity and challenges inherent with medication self-management. So the 6 steps start with the left, the lighter orange colored, as step 1 is fill, 2, understand, 3, organize, 4, take, 5, monitor, 6, sustain. Who would have thought taking medication is such a complex task? So we start off with fill. After a provider encounter, the first step to self-management of prescription regimen is to fill and pick up their prescription. Doesn't sound hard, does it? But evidence in the States shows that 24% of prescriptions for new medications are never filled. So the first step isn't even taken. Potential causes of this phenomenon could be due to drug costs, poor understanding of why the medication is necessary, and also fear of side effects. Poor provider-patient communication can lead to misunderstanding. And this standing of provider doesn't necessarily mean just the prescriber. It could also mean a healthcare person that has been seen after the provider. It can mean the dispensing pharmacist. Also, a new issue is with the implementation of e-prescribing, patients are less likely to receive a tangible reminder of a new medication, such as a written prescription on a prescriber's pad. So what happens to that prescription? It's put into a pocket, wallet, purse, not necessarily filled right away because a person's lifestyle may not allow them to go to the pharmacy. But at least they have that tangible reminder that when they open their wallet, their purse, or check their pockets, the prescription is there, and that becomes a reminder. So with fewer prompts, patients may even be less likely to fill new electronically prescribed medication, at least initially. Once this becomes a habit that they will not be receiving a tangible prescription, it might become a habit that they know the prescription's at the pharmacy. So we've got a compliant patient. They've gone to the pharmacy, picked up their prescription. What is step number 2? Understand. After a prescription is obtained, the next step is to learn how to take the drug safely and appropriately. So that means the ability to name, identify, and understand to take medication in one's medication regimen. And this is a fundamental yet overlooked part of medication self-management. To ensure safe and effective use, patients must be able to track what they are taking, why they're taking it, and how it should be taken to ensure safe and effective use. It becomes increasingly difficult given that patients' drugs are frequently changed by providers. They could be changed in the hospital to the hospital formulary drugs, and then it may be a duplication at their end when they go home, or when a medication that has only been trade name gets changed to generic, and there's another total name on the prescription vial, and the person looks at it as two different medications instead of the same. Now, remember we talked about patients that take equal or greater than 5 medications? Patients taking complex regimens may have trouble differentiating instructions for each drug. And studies in the U.S. have shown that about 75% of primary care patients cannot accurately identify their medication regimen, and about half of them misinterpret either the dose, which is the amount they are to take, or the timing of a prescription. And patients with limited literacy skills have been consistently shown to have greater difficulty understanding instructions. I can give an example of a patient that I did a medication review on about a month ago. Her dose of Adalat XL 60 milligrams was increased to 90 milligrams. I always ask that a patient bring all their medication vials with them, and on the medication vial I read, take 3 tablets daily. I always ask how the person takes it. She explained to me that she takes 1 tablet 3 times a day. So I asked, is this how she takes it? And she said, no, she remembers to take her morning medication, but forgets the afternoon and evening. So we talked about compliance, blood pressure, and then she brings out a vial of Adalat XL 60 milligrams and asked that I ask her provider for a refill prescription because she's run out. So my question was she still taking the 60 milligram tablets? And she said yes, once a day in the morning. Luckily, she was non-compliant with her 30 milligram tablets. So she only took 1 in the morning along with the 60 milligram tablet. So 130 and 160 milligram equaled the 90 milligrams that she was increased to. But if she had been compliant with her 1 tablet 3 times a day, she would have been at 150 milligrams daily instead of the 90. So this became an issue of communication issues between the provider and the patient, and at more than one step, be it both in the office and at the pharmacy. So we reviewed that. No, she will not get a refill of her 60 milligram tablets because she is on 90 milligrams, which is equivalent to 3 of her 30 milligram tablets, to be taken all together 1 time in the morning. Go to step 3, organize. So in addition to understanding how to take a medication correctly, it is essential for patients to organize and plan their medications around their daily schedule. Not only does this include prescribed medication, it includes all their non-prescribed medications too. This becomes an issue. In Canada, in 2012, nearly 2/3 of Canadians ages 65 and up were taking 5 or more prescription medications every year. 1 in 5 seniors was taking 10 or more types of prescription medications annually, and 5.5%, or 1 in 20 seniors, were taking more than 15 prescription medications to manage conditions from diabetes to high blood pressure. And this was accordingly to the Canadian Institute for Health Information. So these clients are risk factors for the number of prescription medications they are taking, also for the fact of their comorbidities, which also decrease their well-being. Now, these numbers that I quoted do not include non-prescription medications such as over-the-counter pain medications, herbal medications, vitamins. So with these numbers, integrating a new medication into an existing regimen and efficiently organizing this regimen has become increasingly important. Consolidating medication use is likely to promote adherence. Studies have shown a link between dosing frequency and medication use. The greater the dosing frequency, the less likely the patients are going to consistently take medication. Now, patients who don't discuss organizing their medications with someone unnecessarily overcomplicate medication use by not consolidating a complex regimen so that it can be taken a minimum number of times per day safely. And patients with limited literacy skills are more likely to overcomplicate their regimen. In the States, they did a study and found that the ideal regimen for taking 14 medications was 4 times daily, and they were taking them 7 times daily. Organization and planning is important even among adults taking a single medication. Tying medication use to a specific time, place, and or daily activity supports consistent use. I have an example where I did a medication review on an elderly gentleman who was on warfarin and was taking it in the morning and doing fine. He was then hospitalized. In the hospital, he was taking it, they were giving him warfarin at 2 o'clock in the afternoon. And he was told upon discharge to continue taking it at 2 o'clock in the afternoon. When we talked about compliance, he was compliant. He said he was compliant with all his medications except for one. I asked which one it was. It happened to be the warfarin because he could not associate 2 o'clock with anything important in his daily schedule. So once in a while he remembered to take it, and most of the time he didn't. There was no trigger factor for him. And thus was the answer to why his INRs were fluctuating. So we reviewed when to take it, and even though the provider said the evening was ideal because if there was a change in his INR, it could be done that day, but beneficial to him taking it consistently, we changed it to once daily in the morning. Certain dosing intervals between medications are very important also. And not only is this among prescription drugs, it can include over-the-counter medication. Many times, calcium or antacids can interact with prescription drugs and have to be separated. And that becomes the important factor in organizing a patient's drug regimen. So this brings us to the next step. Everything's organized, and we're going to take the medication. Now, the patient is required to take the correct dose at the correct interval. Now, does the person even know how to use their, for example, inhaler? Do they have an aero chamber? Do they realize that they need to rinse their mouth out after a steroid inhaler so they will not get thrush? And if they do not know this and continue to get thrush, that can lead to their discontinuing their medication. Timing of medication is important. For example, do they have to take it with food, without food? Do they have to separate it from other medication or take it within a certain time of food? Can they not lie down after taking medication? All these are important steps in when and how to take the medication. Estimates indicate that patients take fewer than 50% of the doses that they are prescribed. What leads to this? Forgetfulness, unclear label instructions, side effects, lack of regimen familiarity, lack of symptoms, and loss of interest. They potentially be the determinant of failure to take medications correctly and consistently. In addition, patients may take less medications than prescribed to conserve their medication supply and reduce drug-related costs. And also, if they have no symptoms, there may be an issue where they feel that they no longer need it. For example, they don't feel their blood pressure, so they think they're fine and do not take their medication. But now we have a compliant patient, takes their medication. What's the next step? The next step is monitor. To ensure safe use, patients must be vigilant when taking medicine and be aware of the safety profile of medications in the regimen. They should know potential side effects, risks, and warnings, for this allows patients to connect symptoms to medication use and seek appropriate action before an adverse event occurs. Also in the States, they found that 54% of patients struggle to comprehend common warnings associated with medicines, and less than 10% routinely attend to this information. And patients with limited health literacy skills are more likely to misunderstand warning labels than patients with adequate health literacy. Now we're going to say pharmacies hand out drug information sheets. Well, the issue with those drug information sheets are they're prepared by drug companies for their own liability. So they include absolutely everything. And then that becomes an issue for patients because they don't know really what's important and what's not, and what to do and when to do it. So it's totally mind-boggling. That often leads to patients not taking their medication or not knowing when to seek medical advice. So it's important to pay attention to important factors and discuss those with patients so that they know what to look for and what to do if they have those symptoms. Also, some medications, side effects, decrease with use. Sometimes they don't, and they have to know that another medication is given to control it. For example, with opioids, drowsing, you start low and go slow, so that a person accustoms to side effects. And as dosages increase, those side effects aren't there. But yet, with opioids, you get constipation. So that's why a patient may be put on a stool softener or a laxative. And if they understand this, they will be more readily to take it. So we've monitored the patient, and that leads us to step 6, sustain. This is the final step in medication self-management, and it's to sustain safe and appropriate medication use throughout the duration of the prescription. Despite the importance of this step, evidence suggests that patients often reduce or discontinue use of their medication over time with deleterious effects. Busy lifestyles, unpleasant side effects, and perceptions that a medication is ineffective or no longer necessary are frequent root causes of discontinuation. And I'm sure many of you have heard well, I stopped taking my blood pressure medication because I feel fine. I monitor my blood pressure at home, and it's fine. So that's why I stopped taking it. Well, it's fine because your medication's working. One of my colleagues told me a good example is that if a person's wearing glasses, you ask them if they can see properly, and then ask them to take them off. Can they see? No, they can't. Well, it's the same with medication. You're feeling well, your blood pressure is fine because your medication is working and you're taking it. So we move on to the assessment of the 6 steps. Currently, available measures of adherence do not take into account all of the 6 steps. We have measures such as drug assays, pill counts, accessing pharmacy records, and they only take into account the fill and possibly if the medication was taken, because actually they could fill it and it could be sitting on a counter at home. But it takes into account the patient's ability to understand, organize, or monitor their medication use. There are electronic monitoring systems available which monitor when a medication was taken and how much was taken. It has to do with the opening of a vial. But it's very, very costly, and it doesn't monitor how the regimen is monitored. There's self-reporting measures that can be used to identify psychosocial barriers, but often in self-reporting, there are overestimates of adherence. So new assessment tools, which are multifaceted, are needed to be used in routine clinical settings to help create a signal to providers that a patient is having difficulty managing their medications and possibly even identifying the specific step of self-management that's involved. Development of intervention strategies can be done by targeting each point of the model: feel, understand, organize, take, monitor, and sustain. Certain strategies have been shown to be efficacious in research studies. Improved prescription labeling can increase a patient's understanding and organization of drug regimen. Reminder systems can assist patients in remembering to fill, take, and sustain medication use. So it looks like our work is cut out for us. So how are we going to help? One way is through medication reconciliation. So what is medication reconciliation? It is a formal process in which healthcare providers work together with patients, families, and care providers to ensure an accurate and comprehensive medication information is communicated consistently across transitions of care. The goal of medication reconciliation is to reduce the potential for harm caused by adverse drug events that result from breakdowns in communication about medications. It requires a systematic and comprehensive review of all the medications a patient is taking. It's known as the BPMH, Best Possible Medication History, to ensure that medications being added, changed, or discontinued are carefully evaluated. It is a component of medication management and will inform and enable prescribers to make more appropriate prescribing decisions for the patient. So, what is the best possible medication history? It's a snapshot of the patient's actual medication use, which may be different from what is contained in the records. This is why patient involvement is vital. So, how is it created? By a systematic process of interviewing the patient family and a review of at least one other reliable source of information to obtain and verify all of the patient's medication use, and that is both prescribed and not prescribed. Complete documentation includes drug name, dosage, route, and frequency. And it is more comprehensive than a routine primary medication history, which is often a quick preliminary medication history which may not include multiple sources of information. Now, with multiple sources of information, you collect from having the person bring in their vials and check what's written on the labels, having a medication record from the pharmacy, and the record from the patient's chart, and having an interview, because the records may not correspond, and that has to be corrected. Also, the important factor is the patient or family or caregiver who helps the patient with their medication, because how they take it is not necessarily what is on the label. So when do you do medication reconciliation? With a new patient, when there are changes in medications, when there are different providers or specialists, and that can be many people involved and many different prescriptions. and not necessarily are they in the chart of the patient. If the person's had a hospital or emergency visit, because then there may be additions to their medications, changes in patient's cognitive behavior, or deterioration in well-being, admission, transfer, and discharge from hospital. So even in a hospital situation, there may be a time when more than one has to be done. For example, upon admission, there may be a transfer in the hospital, for example, from an ICU to a medication ward, and on discharge. What has the person been taking while in hospital, and what are they being discharged on? There was a situation where a different doctor was discharging the patient than on taking care of the patient during the hospital stay. And the hospital discharge medication was different than the patient was used to and thought that they were going home on. So that indicates that there actually should be a reconciliation between what was taken to what was being discharged on. So what do we learn from the medication reconciliation? Why bother doing that? Well, how well a patient can self-manage their medication regimen. Which steps of the self-management model need to be focused on and suggestions worked on together to produce a positive outcome. The possible increase in complexity of a medication regimen once non-prescribed medications have been included. Extra monitoring needed for a client on high alert medications. Is the elderly patient on any medications on the Beers list? The need for referral to health or allied healthcare professionals to increase the client's well-being. Interaction with the pharmacist and a provider regarding possible drug interactions, adverse reactions, streamlining of regimen, other medication choices, or other suggestions. Risk factors as mentioned above. So, how do we help? I found that there is a booklet which can be ordered, and it's called Knowledge is the Best Medicine Handbook. It has information regarding safe use of medications, what to ask your doctor or pharmacist, and living smart. And it also includes a medication record book in which all the medications can be written down, the reason for the medication, who prescribed it, and when it was discontinued. And as different providers are seen, it can be added into or things can be discontinued. Now, this tool can be ordered in bulk as required at no cost. It can be done over the phone or online and submitted online. Also, on this website, if a person is more computer savvy, a medication record online can also be created using this website. And what this medication record can include is personal information, immunization records, medication records such as medication schedule, medication list, a wallet list, as needed medication record, pain medication record, blood pressure record, cholesterol record, tips on medication use. There's an iPhone app for people who have iPhones. It's called My MedRep. It's available at no cost. Its features are a medication immunization record. It can hold multiple patient profiles, so husband, wife can be together on the profile. It has dose, refill reminders, and email information. So a refill reminder that, contact the pharmacy to refill your prescription. Dose reminder, where it will trigger the iPhone to let you know that your medication is due. I had a client who had multiple issues, yet was very, very compliant with her medications. And I asked her what her trigger factor was, and she said her cell phone. Her cell phone always let her know when she was to take her medication. So, how could we help? I'm going to go through step by step. So, step 1, fill. Review the new medication with the patient. Ask the community pharmacist to contact the person when there is a new prescription that is ready. And is the patient going to pick it up, or does it need to be delivered? Ask the community pharmacist to contact the prescriber if an LU code is required, or if it's not covered by a patient's plan, to contact the provider and possibly suggest a substitution. Not to let it just go unfilled and the provider is thinking that the patient is taking the medication. Next, we go to understand. Evaluate cognitive function and see if there's a need for a family or a friend to accompany the patient. Review the name, strength, dosing schedule of the medication and why they are taking it and side effects to monitor. And use the teach-back method in doing this. Review proper medication administration and leave written information. Sometimes patients are bombarded with so much information at a time, they can't remember it all when they come home. So when they have written information, then it just reinforces it when they come home. Ask if the patient has any questions regarding their medication. That's a very important step. And ask the community pharmacist to review the above with the patient, just so they get positive reinforcement. Step 3, organize. Evaluate the cognitive and functional abilities of the patient to organize their vials, dosettes, or is blister packaging required. If home care is required to administer insulin or other injections. Consolidate medication use to promote adherence, including both prescribed and non-prescribed medications. And probably the most important with this too is organize medication use to specific time, place, and or daily activity and have trigger factors. Step 4, take. Review trigger factors to take medications. Review ability to take medications properly. 5, monitor. Review potential side effects, risks, and warnings, and when to seek appropriate action. Apply the teach-back method. Supply written information. Now, monitor for expired or unused medications. Possibly a medication cabinet cleanup is required. I had done a medication review with a patient who brought in all her medication, and I checked when the expiry date of her nebules. So this was probably about, 3 weeks ago, and her medications expired in 2011. One of her oral medications was also dated 2011, but they had been filled many times from that time. So this is a person that a medication cabinet cleanup is required, because is she taking her medication? How much medication is at home? And how many of her medications are expired? This is an important step. Review if any new non-prescription or non-prescribed medications or new medications from the specialist. Update medication record book and do medication reconciliation if needed. Now we're at step 6, sustain. Regularly review if any issues with medication regimen and evaluate the needs. Review if medication still required. I had a patient who was in a home because he had developmental setbacks. he had nausea, vomiting, and constipation, of which it was great. They found a regimen using natural things such as prune juice, applesauce, ginger ale in a combination that controlled his constipation. He was also on Metamucil and domperidone, which was no longer needed. So you have to check if things should be discontinued or put on an as-needed basis. This is important. And has something changed in the person's possibly well-being that they no longer take their medication or aren't able to take the medication? This is an important step for long-term use. Now it brings me to resources. I'm not going to go through them that I've used for the presentation. I do have one more to add, and it is self-medication use, all one word, selfmedicationuse.ca, and that gives information for seniors. Which brings us to thank you for attending during your lunchtime. And just to let you know, pharmacists always are available to give advice. And are there any questions?
Hi there. Okay, so this is Danielle.
Hi.
We do have one question. And it's, do you know of any programs that have been utilizing the online build your own record option and or the iPhone app?
Like a special program involving that? No, it's just on an individual basis.
Okay, I'm also going to unmute Glenn, who asked that question, in case there is more discussion needed.
Okay.
Go ahead, Glenn, if you wanted to elaborate or if that answered your question
Thank
for
you. Thank you. I'd be happy to elaborate a little bit. So just wanting to know that I think that application that you shared in the website, the ability to order those booklets is great. Wondering, are you familiar with any programs, or perhaps others on the line maybe, of any programs or even independent practitioners that are promoting those resources or had some successes with them?
Well, that is through the Canadian Society of Pharmacists that promotes that. And actually, knowledge is the best medicine was originally started in the 80s. And it's actually community pharmacies that promote it. And it stopped existing for a while and now has come back. And I know myself, when I do medication reviews, I use the booklets.
Okay, I'm also going to unmute everybody on the phone in case anybody wants to add to that. Anybody else want to add to that question? Does anybody else have any questions to ask of Luba? Okay, so it doesn't look like we have any more questions, so I'm going to mute everybody. And Luba, did you have any last comments that you wanted to add?
No, I think that's everything. I think that's it. Important that everyone help patients with medication self-management.
Okay, in that case, then I also want to thank everybody for attending our webinar. Tomorrow there'll be a follow-up email sent out with a link to the recording of this webinar for future reference, and also a link to register for our next webinar in January. So if anybody had any technical issues that they'd like to troubleshoot further or have any other questions for us, please contact me on that self-management email that would have been in your reminder email. So otherwise, I'm going to thank everybody again and disconnect in just a moment.